we know the doctors are happy that the vaccine is on its way to approval.
Absolutely.
Where do you stand with being able to get doses for your patients?
Well, Stephanie, at this point, since the state of Florida was the only state, to my knowledge, that did not pre-order COVID vaccines, we have no access to COVID vaccines for children under 5 once it's approved. We expect, final approval from the CDC in the next 24, 48 hours. And typically soon, almost immediately thereafter, again, with the release of every other COVID vaccine allotment in the past, we were able to start vaccinating our patients and families and staff. So it is, we're extremely furious that we are not able to protect our children, our patients. We have many patients, parents that are upset, angry, anxious. They've been waiting, but now almost 2.5 years for a vaccine for the young children. I'm quite concerned. We're all concerned that how does the state of Florida interfere with the relationship that we have with our patients, our ability to help them make correct medical choices to help improve the health, protect the health of children. The state of Florida is putting children's lives at risk because COVID is not benign. COVID, unfortunately does take the life of young children and infants. It also, though, causes severe, serious long-term disease, such as heart disease, other complications of long COVID. So it is really absurd that we are having the governor, the Surgeon General making medical decisions for our patients instead of allowing us as the pediatricians to make those decisions in conversation, in collaboration with parents.
So the State Department of Health says that doctors should be able to order the vaccine through the Florida Shots program, just like any other vaccine. Is that true? Have you tried that?
We have gone online to try that. Again, I know that vaccine cannot be released because it has not had its final approval. But unlike the other COVID vaccine releases, where ahead of time we were able to put in our pre-order, we were just in Florida Shots, the software program in the state of Florida that helps us keep track of all vaccines for our patients. We were not able to place the order as of probably 1 to 2 hours ago. And again, if I know that there was a conversation or someone stated at a press conference that physicians can order directly from manufacturers. That is not true. Okay. It is true for all other forms of vaccines, polio, measles, tetanus, but for COVID, we cannot go directly to manufacturer. It's always been through the state, which is receiving the vaccine from the federal government under the emergency use of vaccines. So this is quite different. In addition to that, even if that was a reality or a possibility, that now does not allow our children who are on Medicaid, who are uninsured, to be able to receive vaccines. So quite discriminatory if that is the approach that the state is taking. And we see children with all kinds of special needs, children from all kinds of different backgrounds. We're here to partner with their parents to provide them with the best advice we can to ensure their health and their safety.
So since the state didn't pre-order the doses, is that why when you go into Florida Shots, there's nothing for you to do at this point?
From my knowledge, the Florida chapter of the American Academy of Pediatrics, which I was the president of several years ago, is actively looking for other options. We have had calls into the Florida Department of Health. We are trying to look at other avenues and how we can access vaccines for our patients. Certainly at this point, I know it's a very lot of activity going on, but we should not have to do that. Okay, we should be able to order COVID vaccine for our 3-year-old patient, our 6-month-old patient, no different than someone from Oregon or from West Virginia or Mississippi. And the fact that Florida is excluding and not allowing that access is horrendous. It's very concerning. And, I think that we as pediatricians, we as Floridians, we as parents and grandparents need to speak up. We need to be able to put pressure on Tallahassee, on the Surgeon General, on the governor to open up access to vaccines. children need to be vaccinated. Children get lots of vaccines. It's safe, it's efficacious. Based on FDA findings, it is not only safe, but it has been shown to be effective in the trials so far for that. So it's a discussion that every parent should be entitled to have with his or her pediatrician. To my knowledge, yes, because there's a whole different supply chain, if you will. Retail pharmacies will be able to obtain this and FQHCs, which are federally qualified health centers. But the fact is that under the emergency use of vaccinations, the HHS did was they lowered the age to 3 years of age, but not lower. So, even if, most parents I don't think will feel comfortable taking their child into a CVS or Walgreens or Walmart as opposed to their pediatrician for a vaccine at that age. Giving vaccines to young children is an art, is a skill, is something that we do hundreds and hundreds of times every day. And this is just another vaccine against a very deadly disease that we want to be able to use. But I think people experience in the care of children and administering vaccines to children is different. It's far different than putting a shot into the arm of a 30-year-old or a 70-year-old. So the fact is we are the ones that are the professionals skilled at doing this, where we know how to do it logistically, safely, and with care and love. So I think those things are of concern for every parent who's out there watching your show. I hope they speak up.